You're watching The Root Causes of Thyroid Disease by Dr. Alyssa Gaul on Resonance Wellness TV, part of our Whole Life Medicine Alleviate series. Keep in the loop about future webinars and events on whole-life-medicine.com. Good evening, everyone, and welcome to The Root Causes of Thyroid Disease. I'm glad to have you here today. I just wanted to start by talking about the fact that many people are frustrated with thyroid issues because thyroid tests can come back negative. And so as a consequence, you can have pretty classical low thyroid signs or sometimes even high thyroid signs, and you're not actually going to see it dramatically on the labs. And we're going to talk about some of the reasons for that today, but hopefully this hasn't happened to you yet. Now, one of the main reasons that we want to talk about this today is that thyroid cancer is actually one of the fastest growing cancer groups in the United States and Canada. This is obviously an infographic for the United States. And women account for 3/4 of the cases. Now, most of the time, people are surviving thyroid cancer, but it's really in an interesting age group, and I've certainly in my practice actually seen thyroid cancer in a fairly young person without much other obvious thyroid history. So we're actually going to talk about this because when you see thyroid dysregulation, long-term you can actually see problems in tissues that can create the kind of conditions where you see thyroid cancer. So we'll talk, like I said, about how that kind of gets there as we're going along. So if those of you who don't know, our lecture from Thyroid today is coming under Alleviate from the Whole Life Medicine model. And that's the first step in health strategy at Resonance Wellness. Alleviate is the first step in my approach to patient guidance. So in short, there's 3 considerations when we're looking at strategies to resolve a health issue in Alleviate. And the first is to consider what are the root causes in our health situation and ask ourselves what the setup is. In tonight's presentation, of course, we're going to talk about this in some detail with respect to thyroid issues, but really all chronic disease has a root cause or more than one root cause. The second is to look at the state of the tissues involved, and in the clean slate process, we look how to improve the cleaning up of the tissues that get bogged down in disease processes. And lastly, we're going to take a look at missing ingredients affecting metabolic repair in your body, and we're going to take a look at how that affects your thyroid. And with those in mind, there are problem-specific programs for particular thyroid conditions. We're not going to have time to talk about all the potential thyroid conditions today, but to give you a sense of it, there's probably about 22 distinct thyroid syndromes. So with that in mind, we are going to take a look at who we're really talking to in this webinar. So really we're talking to somebody who's looking for the root cause of their issues, just like we were talking about, and somebody who values their time, because sometimes it can be a bit of a runaround with a thyroid issue. Somebody who's really feeling like they're at the end of their rope with respect to their symptomatology. Somebody who's witnessing the limitations of the healthcare that the standard approaches to thyroid medicine. Somebody who's proactive with their health, and I know that the vast majority of my patients are amazingly proactive, and I appreciate that and honor that. And also we're looking at people who have probably more than 3 of the following symptoms, and here is a short list. The one on the top, and I apologize, this slide is a little bit, the writing is a little bit small, but the first one is fatigue. Second, brain fog, low motivation, a generalized and unexplained weight gain, and in particular, it's a weight gain that when it's really marked will look like the figure on the right. So those of you that know me, I am definitely a thyroid weight gain pattern person, and so if I gain weight or lose weight, it's in my upper arms, right around the bottom of my face, in my upper chest, in my low abdomen, and kind of in a muffin top, and then the tops of my thighs. And most women who tend to have like thyroid type issues, you won't always have like a thyroid pathology with that body type, because there is kind of an endocrine dominance that can create that. But usually the weight gain is had in that quite specific pattern. Although there are some combination types, if people also have significant adrenal problems or pituitary problems or ovarian problems, sometimes the body will also reflect that as well. But this is the standard thyroid figure. Low thyroid in particular, will have cold intolerance, brittle nails and vertical ridges in the nails, stiff and dry hair, puffiness around the eyes, a poor short-term memory and poor focus, brain fog, depression or anxiety, dry skin, and cravings for carby things like bread or pasta and sweets, high cholesterol, not the greatest libido, a tendency to have cracked or dry heels, low, I already said low motivation, sorry, constipation, or eyebrows. So from about midpoint of your eyebrow edge of your face, yes. And then potentially the next image makes you dizzy. Oh, except for I moved the slide. Let's go one more. Or one more. There it is. Sorry, I misordered those. So this is the image that can sometimes make you dizzy if you're thyroid. So if you stare at it and you're feeling a little bit loopy, that might also be a sign. Okay, so let's just go back here so we can talk about those ones I just skipped. So there are 11 major markers for thyroid disease. And the screening marker that we use is TSH. This stands for thyroid stimulating hormone, and this is the most common marker that we use to assess thyroid function. It is technically the most sensitive, meaning that it'll go up and down with variations in thyroid function. And it's not actually a thyroid hormone itself. It comes out of the pituitary when it gets a signal from the brain, the lower part of the brain that's called the hypothalamus. And TSH levels will increase when T4 levels drop. So that's the majority of the circulating thyroid hormone, not active hormone, but precursor to active hormone. And then TSH will decrease if the T4 levels are elevated. So sometimes and often, this is the only marker that you're going to see ordered on a conventional screening panel. If you're actually having active thyroid symptoms that I would have included on that previous list, and at least 3 of them, then really you should be asking for more thyroid testing. And the other ones that are available are to do a T4. So this is the actual most prevalent form of thyroid hormone. Like I said, it's made by the thyroid gland, and the levels of the T4 in the blood are really the feedback loop for the brain. And the vast majority of it's bound to carrier proteins. So it's not metabolically active, and it has to be converted to its active form to be used by cells to regulate the metabolism. So one of the reasons that you see all the symptomatology in low thyroid like that, why everything looks cold and slow, is because the thyroid hormones, the active thyroid hormone, which is T3, is the main driver of your basal metabolic rate, which is the rate at which you actually produce energy for all of your cellular functions. And I mean all your cellular functions. So the driver behind how quickly your metabolism goes is your thyroid. So T3, if you measure it, is again not directly made in the thyroid gland. It's a conversion of T4, and that takes place in a lot of other places. The majority is the liver, but also in the kidney and also in the gastrointestinal tract. So also the majority of T3 is bound to a carrier protein, but once it comes off the boat, it acts directly on the cell nucleus to really regulate the metabolism of that specific cell. This is on a cell-by-cell basis, these thyroid hormones actually getting into the cell compartment. Now, there's a couple of other versions of testing T4 and T3 Free T4 is the unbound version of T4. And so this is a marker that can be influenced by thyroid hormone replacement and chronic illness and other disorders that affect the amount of carrier proteins. Free T3 is similar. It's an unbound form of T3. This is actually the best marker to see what amount of active thyroid hormones are available for cells. So this also can be affected by things: stress, obviously a thyroid disorder, pregnancy. Reverse T3 is a version of T3 that's metabolically inactive. So reverse T3 is typically produced in cases of extreme stress. So if you've had surgery or a trauma or chronic stress, you can actually increase the production of reverse T3. And that often will mask an adrenal issue. So if it comes from a chronic stress, you'll kind of have this confused picture of looking like you have both thyroid and adrenal symptoms. And a lot of time people do have thyroid and adrenal symptoms together. There's also a T3 uptake. And so what this actually shows is the number of binding sites for the active T3 to bind onto carrier proteins. And these are the sites that allow your T3 to be transported around. And that marker is influenced by sex hormones such as testosterone and estrogen. So when you have problems with estrogen fluctuations, you can have a big impact on your thyroid. And this is also true for men when they have testosterone fluctuations. Also for women, if you have a situation like PCOS, that can have an impact on your thyroid. The next thing is thyroxine binding globulin. So this is the actual carrier protein. So if people have had an infection or liver dysfunction, or they're on hormone replacement therapy or birth control, or if they're taking steroids like prednisone or aspirin, or they're pregnant, this will change. Now, also TPO antibodies. That is thyroid peroxidase antibodies. On the lab test, you'll see it will be listed as TPO. This is the most common marker elevated with autoimmune thyroid. And so this marker is rarely tested because there's really no drugs to fix that problem. So it's, even if people know that that's what's going on, a lot of the time they're going to find that out in an acute exacerbation of autoimmune disease. And most doctors just test it once and then never test it again. There's also something called anti-thyroglobulin antibodies, and that's not as commonly elevated, but also it's another type of antibody. And during thyroid cancer treatment, this marker is routinely evaluated as a tracker. And then there's also thyroid stimulating immunoglobulin, and these are a kind of antibody that's elevated with Graves' disease. So Graves' disease usually comes with a hyperthyroid state. So if you took that list that I gave you before and kind of reversed it, so like you have palpitations and weight loss and, you know, bulging eyes and can't sleep, that is a hyperthyroid state. It isn't uncommon for people who have certain kinds of thyroid conditions to alternate between those two states, not to the extreme, but enough to be noticeable. So I hope you're getting the sense like thyroid disease is not really just about the thyroid. You need brain function to be normal, so hypothalamic function to be normal. Pituitary function must be normal. You have to have the right nutrients present to make hormones. So at various stages in the process, you're going to need iodine or zinc or selenium. You also need to be able to convert thyroid hormone into active thyroid hormone. So it has to be occurring in your liver, kidneys, and gut. So if there's pathologies there, difficulties there, that can make that difficult. And it can make it look like your thyroid is not doing very well, even though it's really a peripheral conversion problem. The circulation through your neck has to be good. You know, sometimes we hold a lot of stress in our neck. We kind of like clamp things down a little bit. It's not enough to like hurt your thyroid dramatically, but it can be enough to change how efficient it is. And your adrenal has to be functioning normally, along with your other hormones, like we've mentioned. So again, there's my dizzy picture. If that still is making you dizzy, I'm just going to quickly slide over it. So at the end of the day, people have a lot of frustrating symptoms from thyroid issues. The guesstimate is that it's impacting probably about 5 million Canadians, and it costs a lot of money for people to suffer with these things. It's probably one of the #1 causes of medical suffering without diagnosis or without clear diagnosis. So by the end of this webinar, we're hopefully going to stimulate you to ask new questions about your own care. You'll know about the common causes of thyroid disease, and you're going to understand why this approach typically is failing people. You'll know exactly what testing to have done, and there's certain kinds of testing that we can offer you from Resonance Wellness that we're going to talk about today. And you're going to have taken action to spare yourself pretty much years of needless suffering. So without further ado, let's take a look at this a little bit more deeply. So again, this is an overview of the kinds of systems that are really affected by thyroid disease, and these are the ones that are most noticeable to most people. The first is that there can be lots of interesting things going on in the throat, like I said, because that's where the thyroid is. It's sitting right in front. If you put your hand kind of thumb and fingers on opposite sides of the front of your throat, you're going to approximate where your thyroid is. It's a butterfly-shaped gland in the front there, and it is palpable from the outside. If it has a nodule in it or if it's enlarged, a lot of the time you can feel it yourself. Somebody who's trained to feel it will ask you usually to swallow, and as it's moving up and down, it's easier to make out the outlines of it under your hands. Because your basal metabolic rate is affected by poor thyroid function, the things that are supposed to be growing and renewing all the time suffer. So the hair suffers and the skin and the nails suffer. These are higher turnover things that are constantly growing and they're obvious to you. So when your basal metabolic rate is poor and you're not making as much energy, the quality of those things is not as good. Same with digestion. The digestion typically slows a lot. It just doesn't have the energy behind it. And a classic complaint in thyroid disorder, especially low thyroid disorder, is constipation. In high thyroid, it can be diarrhea, to be clear. The brain, also with not enough energy, will feel a little bit foggy. It just feels like you don't have full power there. And you can have some interesting, like perturbations of the heart rate. Sometimes it'll go slow. Again, you can also have palpitations. In the risks, people with thyroid disorders are more likely to have carpal tunnel syndrome. Part of that, again, is just repair-oriented and B vitamin-oriented. And then there's an association, like I said, with hormonal issues, so menstrual issues, PCOS, libido, infertility. It's estimated that about a third of miscarriage is actually due to poor thyroid function. That is a very big number, but it's quite likely accurate. And then also we see swelling. Like I said, you can also get facial swelling, especially underneath the eyes. Or around the eyes, but you can also get it right in the front of the leg, and it can make your varicose veins or spider veins substantially worse. So let's take a look at some of the mechanisms of thyroid disease. So I'm going to start here right at kind of 12 o'clock. So exposure to heavy metals can actually be a cause of thyroid disorders. Studies have actually shown that mercury exposure is associated with higher levels of thyroid antibodies. And what's more, the reduction of thyroid antibodies has actually been observed after the removal of sources of mercury exposure. So mercury can actually contribute to autoimmune thyroid disorders like Hashimoto's thyroiditis. The second, if I go to 1 o'clock, is chronic stress. Chronic stress interferes with normal thyroid function, like we already said. In fact, your thyroid might be intact, but stress hormones have an impact on the production of factors that act more like a brake to thyroid function. The third here is oral bacterial overgrowth. Bacterial problems in the mouth can really start the cascade towards thyroid issues. So if you have periodontitis or infected teeth or sites of tooth removal, you can get inflammatory reactions that impact other tissues. Chronic inflammation of any type can be a trigger. So if you have some other kind of inflammatory disorder, it's not unusual to see that is associated with thyroid dysfunction. A leaky gut, which is there at 5 o'clock, where the immunity of the gut is affected by poor barrier maintenance, can cause food sensitivities, stress in the gut, like basically affects the gut, and a poor diet or an inadequate digestive response can really create poor conditions and especially in immune function. We're going to look at this in more detail with a bit bigger of a diagram momentarily. Actual digestive disorder can interfere with a lot of aspects of thyroid function. Obviously, as we talked about before, the gut's a source for about 20% of thyroid hormone conversion. So if you have poor digestion, it contributes to thyroid symptomatology. The microbiome also plays several roles in conversion and sensitization to thyroid hormones. So if you've had a SIBO situation, you may also see an associated thyroid issue. Xenoestrogen. So a xenoestrogen is a compound that acts like an estrogen, And that can actually increase the relative amount of stimulation at estrogen receptors, and that decreases sensitivity to thyroid hormone. So the most commonly known xenoestrogens are things like plasticizers. That's a very commonly like estrogenic kind of compound. This is one of the reasons why there was a concerted effort to remove a lot of the plastinators out of our diets and like food containers like BPA. So the soft plasticizers tend to be more xenoestrogenic. Next is gluten and dairy sensitivity. That is often associated with poor thyroid function. And last but really not least, in fact, number one mechanism is actually autoimmunity. So an autoimmune attack, the thyroid is particularly susceptible to this. And in fact, 90% of hypothyroidism is probably caused by a Hashimoto's thyroiditis, which is an autoimmune condition, not a direct thyroid condition. And like I was saying before, there's probably about 22 different subtypes of thyroid dysfunction coming from various interactions. But this is probably one of the most common thing, and we don't often test for it conventionally, unless you're having an obvious and sudden thyroid issue, or you just have a really clued in doctor. Of course, we can always run these tests for you if you're suspicious at our clinic. We can send you the exact same lab. Unfortunately, it is not covered by Alberta Healthcare, but for probably about $100, we can do a reasonable thyroid panel. So I wanted to really talk today about this this aspect of thyroid function, because I think most people don't really have a sense of this, and it has a bearing on many other things or many other conditions, as we've just seen, that are common and that many of us have had to deal with or explore in our health journeys. So autoimmune disease obviously can manifest in many ways. I think there's currently about 100 known autoimmune diseases. So thyroid autoimmunity is really one of the most common. So a normal functioning immune system is designed to fight off foreign invaders like bacteria or viruses. But if you have prolonged exposures to bacteria and viruses, it can actually lead to overactivity. And then that overactivity can lead to the immune system attacking one's own healthy tissues. So at the end of the day, if a tissue gets in the way, like the thyroid, it's really just kind of a victim of the initial stimulating process. And like I said, it can also be infectious. It's probably not the most common one for thyroid, but certainly there's a lot of association between other autoimmune diseases and infections. And when you've experienced one autoimmune disease, you're more likely to see an autoimmune disease of the thyroid. So like if you have RA, or if you have Crohn's, or you have something else going on that has an autoimmune component to it, this makes it much more likely to see thyroid issues that are autoimmune. So lots of symptoms related to this, and this is just like a little, again, infographic to just kind of drive home the fact that there's so many symptoms attributed to autoimmune disease. And I think one of the interesting aspects of this is that, sometimes these are the kinds of symptoms that are not general, or they're too general, they're not specific enough that people think about them as being very specifically related to, like, say, as an example, your thyroid. So we want to talk a little bit about why this is so common. We're going to actually talk here a little bit about immunity. And I'm going to put on my anthroposophic hat now. So perhaps many of you already know that I'm a trained anthroposophic doctor. And this is an approach to medicine that really came out of the anthroposophic movement, which, as a quick synopsis, really just approaches medicine from the perspective of a human being as a body, soul, and spirit. And that each physical pathology starts first within the layers of that experience that really makes us uniquely human. Obviously, I can't explain all the elements of that here. That's hopefully going to be a future webinar. But let me explain. But that when immunity is dysregulated, it is a symptom of a particular set of conditions within a person that are not operating correctly. So the immune system distinguishes self from non-self. And immunity has two general divisions. One is the innate immune system. So this is the part, like the non-specific defenses that are engaged when you're acutely exposed to like a pathogen. So, like when you get a cold and you've got like your nose is streaming and you're sneezing and you're coughing on your own mucus, that's actually a non-specific defense, at least initially. And this is common to almost anything that you come in contact with. You're going to have some sort of non-specific response. Diarrhea is another potential one, especially early stage diarrhea. The second part of the immune system is the adaptive immune system, and that's the thing that creates memory of what you've been exposed to. And part of the rationale as to why we think that that's happening is that so you just have a more rapid defense against whatever that exposure or bacteria or virus was the next time you come in contact with it. But here is the problem. The immune system is really designed to work a little bit as a 1-2, so you're designed to engage in the non-specific defenses first, and then the memory process as a result of that non-specific defense. So snot is supposed to be the precursor to learning what bug you just got the snot from. So it's really a full exercise in self versus non-self. And this is a great graph that talks a little bit about this. This is showing an inverse relationship between the incidence of like the prototypical childhood infectious diseases, except for tuberculosis and hepatitis. Those are obviously bigger person diseases. And the incidence on the second graph is of general incidence of immune disorders, and there's a couple here that have been named. So this is an interesting graph. This is incidence. This is not death or anything like that. Just in number of cases. And so what you can see as the number of infectious disease cases decreases over time, the amount of autoimmunity goes up. So culturally, we've decided that infectious disease is an enemy. And we don't see the purpose of we don't see the short-term purpose of it. But I think it might be that our impulse towards minimizing infectious disease, we're actually doing ourselves a pretty big disservice long-term. So these are obviously just some examples, and this can't be taken to mean that the incidence of infectious disease itself has a particular correlate to another chronic condition. But the need for the human and its immune system to learn self from non-self is crucial, and we often interfere with that process. Unwisely, I think. So this is an interesting thing to ponder. I will not be able to prove this for another 30 years in my own patient population, probably. Now, we can also see here that many of the autoimmune diseases, this is a graph showing female versus male sufferers of various types of autoimmunity. Obviously, the autoimmune diseases are more strongly experienced by women. So besides the obvious conclusion that women are more likely to need screening for autoimmune disorders, there's also an interesting question as to why this might be the cause. One interesting thing to note is that women who are pregnant are actually infused with stem cells from the fetus, and that contains information from both parents. And I've often seen a Hashimoto's thyroiditis, that's a most common kind of immune thyroiditis, appear in late pregnancy or postpartum. And so it's possible that this is one of the things that's going on, that, it's happening more frequently in people who are pregnant. And it's very true. You see this a lot of the time triggered after pregnancy. I think too, culturally, women are often a little bit identity challenged, and the issue of self versus non-self really extends beyond the bodily workings of immune cells. But regardless, you can see here that the relative risk of autoimmunity is higher as a female. Now, why do these processes not go become recognized until later in these processes? I think the answer for that really has to be because it takes time for a tissue to be damaged enough to show symptoms. So this chart shows in a kind of general way that the activations contributing to an autoimmune condition or thyroid condition can precede actual symptoms by quite some time. And this is really similar to the homotoxicology graph that you might have seen me use before, just here. So this is a disease evolution table. This is actually a table from the International Society of Homotoxicology. And this is a very nice look at how you can see a progression of symptomatology, both in the thyroid, so I kind of highlighted it here in yellow, and also in the immune system because it happened to be right beside it. So here you see in a humoral phase and a matrix phase and a cellular phase, and you see this big biological division line that's green. in the middle of it. So from a naturopathic perspective, diseases are really an expression of biologically purposeful defense mechanisms against both internally produced and externally produced toxins. So it's an expression of the organism's effort to compensate for damage it's sustained. So here we see that line again over which the compensation can't be produced. So there's more tissue damage than repair on the right side of this line. So the disease might not actually be symptomatic until way over the line, or you might have recognized kind of the run-up, or you may not have recognized the run-up to where you became symptomatic. So what you see sometimes is not what you get. The symptoms are not only the result of a defense activity of the organism against its toxic burden. So like, for example, an inflammation is there. Causal treatment means that we have to do something about the inflammation triggering the tissue condition, which can be done by the regulation of the defense activity. So just as a suppression of the symptoms is comparable with pushing an iceberg under the water, hoping that it won't appear again, stopping the pushing makes the iceberg reappear. And so the phenomenon explains the recurrence of disease in conventional medicine. It's like you're not really sorting the issue, you're just changing its clinical expression. So like, as an example, if, let's say, the word somebody speaks as an expression of their thoughts. So if you just suppress the words, or, you stop that person from talking, you're not really changing the cause of the talking, which is the thoughts in the mind of the speaker. So, obviously if you have something like that going on, you want to treat the mind with like psychotherapy if people are having difficulty suppressing or like managing certain thought processes. It's the same for every other tissue. There's going to be a visible and an invisible type of progression of symptomatology. So like I was saying before, if you have one autoimmune condition, you likely have another. It's about 25% of people with autoimmune diseases have a tendency to develop more of them. And so for people who have more than one diagnosed autoimmune disease, I think it's the definition actually, if you have 3 definable diseases, and usually one of them is a skin disorder that's autoimmune. It's actually called polyautoimmunity, and it can go basic, or it's defined as a multiple autoimmune syndrome. So it's much more common than I think we think. But unfortunately, if you're looking at this issue from a broader perspective, you can kind of start to see a bit of a spiral, in terms of how people experience one condition turning to another and another. So you get the stressors, you have a dysfunction, you're creating symptoms that eventually turn into disease, then you get the diagnosis, then you do a treatment, you might do a suppressive treatment, then you still have stressors, and you kind of go around in a circle in this spiral. So one of the biggest challenges for me is to communicate to patients what a condition actually represents in the grand scheme of things. It is not just a set of symptoms to be suppressed. Of course, I don't want people in discomfort either, but it is crucial to see a condition as more than the experience of the symptoms on a daily basis. Rectifying how a patient can engage with a process that produces health, that's really key. So there's also the very interesting thing that many of us do, which is waiting for a diagnosis to surface instead of focusing on the pieces of your health that you can improve in this moment. And it's not unusual, and this is not meant to be scary or threatening, but I'm always surprised by the number of people who say, I was healthy as a horse until I got cancer. That is just not possible. There is a long run-up to that set of conditions, and we just tend to dissociate from things that we think are minor or things that we think are normal. Like, as a great example of that would be, we think heartburn is normal. We see it's the most used over-the-counter drug class in the world, is using like acid suppressing agents. People think that's normal. That's not normal physiological function. That's abnormal physiological function, but we've normalized it, and we have something that just suppresses the symptomatology so we can carry on. And that's unfortunately not the best strategy long-term for any aspect of your health, not just stomach function. So let's look at some of the drivers of autoimmunity a little bit more deeply. Now, the first thing we're going to have to talk about in some degree is genetics. So I want to be really clear though here, because genetics is really the inheritance of factors that lead to the expression of disease. This is like DNA inheritable. But really, in the case of thyroid illness in particular, these genes are really related to immune expression. They are not, we kind of have this tendency in our minds to think, oh, you have this one gene that's wrong in you, and that gene actually is producing your condition. That is highly unusual. There's only a handful really of diseases that are like that. A classic example of that would be cystic fibrosis. This is like a one change in one protein that makes an abnormal protein, and that's almost the entire disease state. That is exceptionally rare as a kind of disease. Not just cystic fibrosis, but that mechanism where you have one like deletion in this case, and it's actually creating the entire cause of the condition. Most of the time, we're seeing changes in expression. So to a degree, we'll see trends in a family related to thyroid disease. But it's not directly heritable. So like we showed before, the potential can be there. And then there's a number of other things that can set the reaction off. And this is actually epigenetics. So it's a link between susceptibility genes. So say you have you carry like an immune expression gene that's not ideal, and then you get into a circumstance where you have an environmental trigger or some other like disease supportive factor like high stress or hormone imbalance, viruses, bacteria, heavy metals, methylation, and that's where you actually start to get the load that creates the problem. So, we have made a lot of progress in genetic understanding. But really, the mechanisms by which gene variants interact with environmental factors to cause autoimmunity or thyroid disease are really still unclear. We do know, though, that making changes in epigenetic factors, so things that are in the environment or things that we have control over that modify gene expression, can improve pretty much any autoimmune disorder. And I'm sure those of you who know me directly will know that I often use metabolic typing in times where we have like an autoimmune disease, because what I want to know is what's the absolute best way of working with the gene, like your strongest metabolic pathways, so we can feed the pathways that actually work the best for you, so we can get the best cellular energy and we can get a resolution of inflammation where nothing like nothing else. There's no drug that comes close sometimes to some of the changes that we can produce with diet alone. So I'm just going to put that bug in the ear, shooting that across the bow. So I wanted to show you some of the places where you start to see sensitization. So this, hopefully this doesn't scare anyone. I borrowed this from Wikipedia, as you can see on the bottom. This is a really nice illustration. But basically what this is showing you is a follicle in the thyroid and the cells of the thyroid. So here we have like a thyroid follicular cell in blue. And what it's showing you is that in the nucleus, which is the orange thing with the green inside, which hopefully it isn't orange with green inside, that would be kind of weird, that it's actually the nucleus is responsible for reading off of the DNA the pattern for thyroglobulin. So thyroglobulin is basically the precursor protein / hormone that you make, that is the precursor to T4 and T3. So here you'll see that the cell is producing it and pumping it out into this kind of like tube here, this little place where you're going to make some interesting chemical reactions happen. And there's an enzyme there called thyroperoxidase. So I've just written it in red underneath here, where this thyroglobulin is oxidized and iodinated to make actual thyroid hormones. So once that reaction happens in this lumen, it's taken back into the thyroid follicle cell. The carrier protein part is broken off, and then the thyroxine so that's T4 and T3 are excreted out into the blood. So from within the thyroid hormones, this is not like into the general circulation, it's into the circulation of the thyroid and then out towards the circulation. Now, what's interesting about this is this two of the main antibodies that we talked about, thyroglobulin antibodies and thyroperoxidase antibodies, are actually having their impacts here inside this place where these conversions and productions are being accomplished. And so this is one of the reasons why autoimmune reactions here decreases the amount of available thyroid hormone. So sorry, I went all sciencey there for a second. The second major driver of autoimmunity is chronic stress. So strongly associated with the development of autoimmunity. And why is that? And why that is because everything is wired together. Chronic stress is across the entire body, or chronic stress across the thyroid area and functionally related structures is a definitive trigger for autoimmune disease. So depending on how you handle a trigger, the self versus non-self function can be affected. When you're constantly in like fight or flight mode, which is sympathetic nervous system mode, your rest and digest and heal and de-traumatize functions are not engaged well. It's really hard to do both of those things simultaneously. And stress is rampant in our society. Again, we completely underestimate how stressed people can be. And, just because you don't like not having a negative mental breakdown doesn't mean you're not taking a lot of stress on. You winning the lottery and moving to Bermuda is like the equivalent of a death. Many people have heard me say that. Positive versus negative. There is no such thing as positive stress that's not affecting you physiologically. It's not an integer. You're not canceling things out by taking a vacation necessarily. There are definitely justifications for taking vacation. Don't get me wrong. But really, it's balance here. So one of the biggest problems is that many causes of stress are just not considered stressful by traditional definitions. And most individuals perceive a situation as stressful either physically, like a bodily injury, or emotionally, such, if you've lost somebody. But the chemical component of stress is ignored. In our food and water and air, we're contaminated with all sorts of chemical stressors, harmful on a daily basis. We're exposed to cell phone and radio signals on a daily basis, Wi-Fi, towers, electromagnetic field radiation. On our commutes to work, we're exposed to exhaust fumes. In our homes, we get exposed to all these chemical cleaning agents and off-gassing. And like you bring a new piece of furniture in, and the first thing it does is it degasses itself in your living environment. These are stressors. And the result is the same. The body reacts to stress. And while it's a natural part of our stress response, to release hormones like cortisol, chronic exposure really leads to a pathological outcome. And you can really see this. Now, this is one of the main reasons why we retrain your stressors with Amvita remedies. If you've had Amvita remedies, this is one of the impulses behind that, is we're trying to make you less likely to jam certain kinds of stressors in your body on a daily basis repetitively. So if you look at stress and thyroid, this is a nice illustration from one of my ND educational websites. This is basically just showing that when you see adrenals pumping out cortisol to help respond to a stressor, you actually can really cause a conversion of T3 into its inactive form, reverse T3, and you reduce T4 release. So basically, you're going to just decrease your metabolism globally. And that's even if you don't have something wrong with your thyroid already or some other factor. So we can't separate these things out. Now, on the right-hand side here, there's a couple of things that are mentioned here for just stress relief and also thyroid and adrenal support. Hopefully, lots of you have been exposed to the potential for using those types of things. And if you're not, make sure to ask me about it the next time you're coming in. Third, also very important causal area is damaged gut linings. Often this is referred to as leaky gut. It's not the absolute best terminology for it, but this is a really important area of concern in autoimmunity because you have more immune system in your gut than the rest of your body combined. And it is totally integrated with your neurology. Again, so if you've done like abdominal and Vita remedies, this is actually having a big impact on the system. So if you have poor diet choices or poor digestion or your food sensitivities, this all challenges this. But at its core, it's the maintenance of appropriate immune function that the gut is doing, and that's a strong energy movement from within. So most of your immune system is in your guts, and so if things go wrong here, it can have a big impact. And this is actually where we're going to look just a little bit deeper, especially with thyroid. So signs of a leaky or kind of permeable gut will have, again, these a little bit non-specific things like digestive problems or foggy brain or low energy, weight loss or gain, bloating, IBS as a diagnosis. That stands for irritable bowel syndrome, skin issues or joint pain. So a lot of the time, these are signs of where the gut's being damaged by immune mechanisms. They're non-specific and they're super common. So lots of people don't think about these things as precursors to to something bigger, just happening generally in the digestive tract. So another key contributor here is this leaking. So your gastrointestinal tract is a natural barrier, and it's pretty selectively permeable to molecules that your body needs. So the lining of the tract is really razor thin. It's one cell. It's a single layer of cell that's held together by a set of cell adhesion molecules, otherwise known as tight junctions. And in a healthy digestive tract, these tight junctions are really holding together like a zipper. So you can see here that you have, like, I put a couple of illustrations here because it's really, I didn't think that this one was totally showing you everything, but in the pink cell part, you can see that there's multiple layers of defense here gluing these cells together. But where those cells or where those defenses get broken down, things have really easy access to the bloodstream. The bloodstream is pretty close. There's a little layer of connective tissue underneath this layer of gut cells, and then you've got a capillary bed. So if you have prolonged inflammation, the tight junctions can become damaged, and it starts looking like this, picket fence with compromised barrier, and it's granting all sorts of foreign molecules total open access to the rest of the body. So it can be like a bacteria or a toxin or undigested food particles. And once those particles make their way into the body, the immune system really doesn't have any choice but to think about them as being foreign and label them like that. So that locally creates a lot of inflammatory cascade. That doesn't just create more permeability, but it also creates systemic inflammation. And this doesn't happen overnight. So it can be caused by years of inflammation and provocation. And as the GI tract gets damaged, the cells start to become unable fully have this function as a barrier. And it can lead to food sensitivities and malnutrition, bacterial overgrowth, yeast overgrowth, an immune system that is not happy. So protecting this barrier is a mucosal layer. That's composed of your bacteria and all of your mucus and defenses and enzymes. And then this immunological barrier is supposed to be there, but it's supposed to be intact. And in lots of people, it is not intact. Again, we do things like inhibit all of our stomach acids so that all of the timed digestive responses don't work. Now, I want to bring up another really strong association for you with thyroid disease, and that is actually gluten sensitivity. Now, this is actually a picture of a normal slice of gut wall on the left. So that's A. So that's showing you those little villi. So this is not the... it's actually like those little projections like we saw illustrated on that last slide. There obviously there's tons more that are obvious here, but you can't see the whole cell. But on the left, this is pretty normal looking for those cells. On the right, this is showing you big damage. So this is what it looks like when you have had an immune reaction to gluten and a loss of barrier function. There's a total dysregulation of the normal look of those tissues. And why am I pointing this out? Because up to half of people with thyroid problems will have an issue with gluten that's worth investigating. You may not, but if you do, this is what that can look like. And you can just have an idea that that's not normal gut function. You can create some very interesting problems with that. This is a paper by Alessio Fasano. He's been a researcher in pediatric gastrointestinal pathology for many years, and I met him years ago. He lectured about gluten intolerance here in Calgary probably over about a decade ago at a conference. And here's a paper that he's basically publishing, clinical allergic immunology, where he basically shows how many aspects of leaky gut and autoimmune diseases are related. And so this is a very nice summary article if you are at all inclined. So Allison is just asking me if the celiac test that is run comes back negative, does that mean there's no immune response or sensitivity to gluten? No, it just means that you don't have the autoimmune induced celiac destruction. So you can have gluten sensitivity, you can have gluten reactions, you can do a lot of damage to your interior intestinal barrier and not have celiac disease, for sure. So, again, I'm going to come back to this. How are we going to identify this process before it becomes a more severe problem? And I think part of it is that instead of waiting for that diagnosis to surface, instead of focusing on health, what we're going to want to do is ask for the right testing, ask the right questions, and ask a person who believes that you're symptomatic, and who will run the test for you. And again, unfortunately, some of the most basic and useful thyroid tests are totally available at like Calgary Laboratory Services. We just underutilize them. And it's a shame. So I'm going to show you kind of what a typical lab result looks like when there's autoimmune disease of the thyroid already started. So this set of results is actually showing pretty clear autoimmune markers to thyroid protein and enzyme. So here you can see thyroglobulin antibodies. They're supposed to be under 41. They're actually 6,200 in this case. Or thyroid peroxidase antibodies over 1,000. They just like stop counting here. It's supposed to be under 35. And then you'll see at the bottom that the classic, like the free T3 and the free T4 are actually also out of the range. The TSH here is also out of the range because this is already starting to get quite marked. So this is showing high TSH. A high TSH is saying that the thyroid is not responding to the pituitary, and the pituitary is making more thyroid stimulating hormone. So that gives you just kind of a little bit of an idea of what it looks like when it's kind of done. And like you're ready in a set of circumstances where you're actually going to be needing probably thyroid hormone and also a lifestyle approach, because the thyroid hormone will not fix that 100%. So obviously it'd be much nicer to find out a bit earlier. And we actually do have some things to look at. So here, obviously, this is what we covered today. We looked at, like thyroid cancer is the fastest rising form of cancer. We looked at how many autoimmune conditions can be related to each other. We looked at some of the strongest mechanisms of thyroid disease. In this case, we looked at predominantly autoimmune. We could talk a lot more about some of the other, 21 types that you can create with various bodily conditions. But this is one of the most common things. And then we also talked about the drivers of autoimmunity. So genetics and epigenetics, chronic stress, and a leaky gut or a damaged gut. So I'm hoping that you're going to start thinking about different questions about if you do have a thyroid disorder, if you do have some of this symptomatology. And I hope that you're really understanding now why this can become more complex than just test this. If the screening test comes back negative, you're assumed to be free of thyroid disease. And I'm hoping you kind of have a sense of what testing you might be able to do. And I'm hoping that you will take a little bit of action if you feel like this is having some impact on you. So at the end of the day, I also want to introduce something to you that is kind of a more recent development, and that is that we can actually do some fairly cheap autoimmune screening now. And we can actually do it by saliva test. So there's two actually best tests to screen for autoimmunity. One of them is actually a very expensive blood testing panel. So this is where we actually can look at at everything. And if you do have autoimmune disease in your family and you're a bit curious about like whether or not any of yours are starting to show up, or if anything is starting to show up, this is a nice way of testing it. However, it's very expensive. It costs over $2,000 to really get that going. The second, and you can see all of the things here that we're testing, and Allison is actually doing some of the testing for at the actual gut wall level. But what you can also do is you can do a multi-system screen for a lot cheaper. It's about $380. It's a saliva test. And on that test, you can actually do the test against wheat, like so to see if the immune system is actually having a freak out about wheat. So here you can see them as gamma gliadin and gluteomorphin. These are just some of the things. This is also a test that shows us if there's a handful of common food triggers, if there are some heavy metal reactions happening in the system. It's just a very nice overall screening. We can see, do you have some gut dysbiosis? Do you have the beginning stage of autoimmune reactivity to the intestinal barrier? That's what occludin and zonulin are. We can see whether or not you have gastrointestinal inflammation. We can see if there's any immune reactivity to the enteric nervous system. So this is a reaction between dietary proteins and infectious agents with the nervous system tissue. And we can see whether or not your blood-brain barrier is being affected. So there is some association with having neurological disorders or memory problems or neurological damage like multiple sclerosis with some of these triggers. And so you can actually do a fairly simple test. So if you guys have immune history, or somebody in your family has immune history, or you know that there's thyroid difficulties, there's a sequence of things that you can totally do. The blood panels, like the normal blood panels like I showed you earlier, they usually run about a little over $100 for getting most of those things done. Except for some of the more specialized antibodies, which you kind of can add on to there. But this is actually a very nice screen. So hopefully, this is an easy test. Little kids can have this test too, or even people that are really sick or who really don't like blood tests. So you get a lot of bang for your buck out of that. So I'm hoping you've got some ideas. We covered so much here today. I know it's overwhelming sometimes when I give you these like 1 hour synopses of like major disorders, but I'm sure that you've gotten hopefully the basics. And again, every time you show up to one of these webinars, you're on your way to making a difference. So I'm really hoping that there's some suggestions that are just what you need to get started. So here's the next events in our series. You can register in advance online at whole-life-medicine.com. That's our resource site that you should go take a look at. We'll also hopefully be holding a live event. I was trying to plan this for October, but I just got super busy. I just couldn't get it managed. So hopefully in this next couple of months, we're going to do a live event where we're actually going to do a much deeper dive into reconnecting pathways and learning what sort of things you can change and really have a transformational experience of yourself health-wise. So hopefully we'll definitely come and see the next one, which is actually going to be managing arthritis. And just to answer this last question that Erica has here with the blood-brain barrier protein gives some information and insight into potential for developing dementia. Yes, and in fact, this same company currently has screening for dementia, Alzheimer type dementia that is similar. And it's a brand new kind of test that is similar. It's another immune array. I don't think that's saliva though. I think that one is a blood test. It runs about $500 and it actually measures a whole bunch of markers that could potentially contribute to that kind of dementia. And then, why did Crohn's disease fluctuate so much in comparison to MS? That is a good question. I'm not actually sure. Sometimes it's reporting or it's diagnosis, like improvements in diagnosis. In medicine, there are trends. It doesn't seem like there should be, but there's diagnostic trends. So sometimes things will go up and down depending on like diagnostic trends. It could also, be related to factors that we have absolutely no clue about. I think over time, the reporting of those diseases has gotten better. Honestly, you see every time you see more awareness around a disease, you'll see a spike of diagnosis around that disease. So sometimes it actually represents that people are getting more information, just like you're getting more information about thyroid disease right now. And the more people that have that information, the more likely people are to be diagnosed it. And then it looks like a spike on your data. So I don't know what the exact reason for that is over that number of decades, but that's my guess. Maybe I'm going to go look into that a little bit more, Caitlin. So I hope you all had a great time and I filled your brains and that you'll think about your thyroid health and the other basic things you can do to prevent autoimmunity all on your own. So again, take care of yourselves and hopefully we'll see you in November for managing arthritis. Take care, guys. Good night. Thanks for watching. I love to connect to my patient community to inform and inspire, and I hope you'll join us again in the near future. Don't forget to check out whole-life-medicine.com for more webinars and events.